Medical Society. And we were with all the biggest names in academic medicine. We were with the chairman of departments. We were with the presidents of medical schools. We were with all the names that had written all the articles. And we were with the biggest of big pharma. People who had spent hundreds of millions of dollars to have palatial booths at exhibit halls like the one we were in. But we were there to talk about hemp. And with a big flurry of activity, coming down the aisle, headed towards my booth, was a man who we will call Dr. Ego. He was the president of the big medical society, and with his entourage in tow, he came directly towards me. And like being a good young doctor, I stood up straight and I straightened my bow tie because that is the appropriate wardrobe for such an event. And he came up to me and he said, "What are you people doing here? Because this is about legitimate medical science." And he looked approvingly at the guy with the body piercings. And I didn't know what to say. I said, "Dr. Ego, I'm so very happy to meet you. My name is Randy Fink, and I'm familiar with your work." And he interrupted me. And he interrupted me not with his words, but with his withering stare, a stare that would have, quite frankly, caused flowers to wilt and children to cry. And he said, "It's funny because you don't look like one of those pothead hippies." And I said, "I'm not. But what's even funnier is that you don't look like a human anal sphincter, but you act like one." And that was my time. That was the moment that I realized that we had some work to do, that we had to start changing lives by changing minds, one mind at a time. And I will tell you that I've since become much closer with Dr. Ego. We started talking after that, and we've actually collaborated on a number of things, and he enjoys telling that story as much as I do. But really, it did articulate that the time was now. So I love it that the logo for CBD Expo is that right time, right now. And so we're going to talk a little bit about right time, right now. But I will tell you, I believe it is no accident that you folks are in the room. And that we are here together in Seattle because you are a group of leaders. I'm not one of these people who thinks that everything happens for a reason, because honestly, there's a lot of things that are really hard to understand. But I think a lot of things happen for a reason. You understand this power of CBD. You know what it can do. But I think it's our job to change minds and to change lives one mind at a time. So, again, my name is Randy Fink. I am trained as an OBGYN. I went to medical school in Virginia and did my residency at Brown University in Providence. I've been in private practice in Miami since about 2000. I live in Miami, Florida. Actually, I live in the Florida Keys. We have two offices in South Florida, in the Keys and in Miami. And I do predominantly hormone wellness now, sexual medicine. I like to think of myself, I'm kind of a sex doc. I can think of worse kinds of doctors to have to be. So I was chatting yesterday with a colorectal surgeon, and I said, he says, "And what kind of doc are you?" I said, "I'm a sex doc." And he says, "Oh, well, okay, I'm just going to leave it at that." So to each his own, and that's fabulous. What I'm going to tell you is that we understand that our industry is no longer fringe. This is not who we are. But a lot of people don't get that yet, right? CBD is not about Rastafarians in a drug den. It's not about people standing on a street corner. It's not about guys, fancy dapper fellows selling snake oil out of the back of a of a covered wagon, and it's not just about something that you buy at the pet store for your doggy's arthritis. Right? There's a lot of things that we can do. There are a lot of lives that we can change. But I really think it starts with education. We have to be able to talk to people and to help them to understand what it is we do and why we do it. So with that, I'd like to propose a little simple language. These are things that you probably all it's very basic. I'm not going to load you with science on this because I don't think that that's what we're here to do, what I'm here to do. There are really, really smart people that are in this complex, and I wouldn't necessarily say I'm one of them, but I know how to talk to people. And so I'm going to tell you kind of the way I explain to people what CBD does, how it does it, and I would suggest that we develop some similar kind of language so that we can communicate with people about what it is we do and why. So, the body has a system. We call it the endocannabinoid system. Many people say that it is the most important system in the human body. And I would have to say, well, I personally think the reproductive system is more important, but I'm just that. Some people say, oh, the heart is pretty important too, and I say, yeah. But the endocannabinoid system is everywhere. And do you know how I know the endocannabinoid system is everywhere? Because if I look at this drawing, I see lots of little circles with lines pointing all over the body. So that's probably a good key. That's a key. That's sort of how you know. The endocannabinoid system is in the central nervous system. It's in the peripheral nervous system. It's in the gut. It's in the reproductive system. It's in the musculoskeletal system and the immune system. The endocannabinoid system is everywhere. All right? It's made up of receptors. Receptors are like TV antennas. Each little cell has a TV antenna that receives a signal from something. Now, the most common, there's probably at least 4 receptors, but the most common, we'll call those CB1 and CB2. You will see those names here and there. Those are the names of the little TV antennas, and the signal that they are receiving is coming from our endocannabinoids. That is anandamide and 2-AG. All right? Since these are chemicals in the body is a factory, right? It makes these things itself. So there's some chemicals that make these chemicals, and there's some chemicals that make these receptors and that break them down when we're done with it. That is the endocannabinoid system. So what does it do? It does this. Homeostasis is the term we use in science and in medicine, meaning balance. It balances us. The way I like to describe it is that the endocannabinoid system figures out which of your cups are half empty and tries to fill it. Nothing more and nothing less. That's what it does. So endocannabinoids, endo meaning inside our body. We've got those chemicals inside our body. And what are they called again? Endocannabinoids. And what are they? They are anandamide and 2-AG. Exactly. Well, nature makes cannabinoids as well outside our body. They come from plants. And what do we call plant-derived substances? Those are phytochemicals, plant-derived. The phytocannabinoids come from one of 2 places, right? It comes from marijuana and it comes from hemp. And so when I explain this to people, everybody's familiar with marijuana. Marijuana is bred to be high in THC, and it's intoxicating. The hemp plant was originally bred for what? Rope, fabric, yeah, exactly. And then we learned that, wow, it's actually high in a phytocannabinoid that we can use. Really, there are 3 species, there are 3, let's call them 3 flavors. The indica, the sativa, and the ruderalis. You're probably most familiar with these 2. So sativa, hemp comes from sativa. Marijuana can come from either. Ruderalis is it's a short-statured plant that is it's naturally low in THC and naturally high in CBD, but its stature is so short that it makes it really commercially not so viable. So from a grander agricultural or economic scale, doesn't make a lot of sense to grow it because you get just better industrial yields that come from sativa. So you don't see it around really so much. But the two principal phytocannabinoids that we all know and love, THC and CBD. Now, people say, oh, okay, THC, that is psychoactive, and CBD is not. Have you heard people say that? Right. I challenge you to not use that language. As I walk through the exhibit hall, I see that there are, even not just printed on people's marketing, but even on their banners and on their signage, non-psychoactive, and that is absolutely not true. Because if any of you have ever tried to use a little CBD to help you with sleep or with anxiety, you know that absolutely it's psychoactive. It's not intoxicating, right? So THC is intoxicating, but they're both psychoactive. THC causes intoxication, while CBD does not. Now, we know that there are 120, 140 other phytocannabinoids, and that's what we refer to as that broad spectrum, that rich spectrum of phytocannabinoids. They each do something. They do together what we know as the entourage effect, and that is that the whole is greater than the sum of its parts, right? That's synergy. That means that when they work together, they do more as a team than any couple of them could do alone. That's the entourage effect. Now, what we're going to find out, I think, as time goes on, certainly in the next, it may take another decade, but in that next decade, we're going to see that, maybe this one, maybe CBG or maybe CBN or something other than CBD is going to start to increase in popularity, because what we're going to find is that as we change the ratios of these things, we'll find that different ratios affect different disease states in different ways. It's going to take some time for that to happen, and it's going to take some research, and it's going to take some patience. But undoubtedly, that's what's going to happen. I believe that CBG is probably the next biggest thing that's going to happen in the industry. And so people who are ahead of the game are starting to grow plants that are richer, or extraction methodologies that are richer in things like CBG. Now, I want to talk about clinical practice and what that means to me and what it means to patients. But I will start with this date, June 16th, 1997. Anybody know where they were on June 16th, 1997? Probably not. I mean, unless it's your birthday, right? But I know where I was on June 16th, 1997. It was about probably 2 weeks after medical school. Now, I was a little older than most of the other graduates. I had a career before I went into medicine. But I, a couple of weeks before, left those hallowed halls with an MD behind my name. And do you know what that? It meant that I had an astronomical amount of loans, right? And that was the first part. But it meant that I had crammed so much knowledge into my head and into most other orifices in my body that I was a walking encyclopedia. But what I didn't have was any experience. And so that's why, in academic medicine terms, if ever you get sick and you need to go to a teaching hospital, you don't want to do it in the beginning of July, right? Because that's when the new interns start. That's when each other year is moving on to a new set of responsibilities. And so everybody's doing something new. But you have a lot of very smart people, a lot of people who are filled with knowledge but with no experience, who are trying to take care of you. And I was absolutely no different than that. But I was on an airplane that day. It was a U.S. Air flight. You remember U.S. Air? Right? Oh, that was a blast from the past. It was a U.S. Air flight from San Francisco to Philadelphia. And I had just sort of started to settle in and relax when I heard the dreaded PA. Ladies and gentlemen, if there is a medical provider on board the aircraft, please identify yourself immediately. And I looked around. I've traveled a fair amount, and to be honest, that's probably happened a dozen times since. Each time successively, I slink a little lower and a little lower into my chair and wait a little longer, hoping somebody else will ring the call button. But in those days, I was young and inspired. I say now I'm sad and tired, right? But I was full of knowledge, and I said I could do anything. So I rang that call button, and the flight attendant came and grabbed me by the wrist and pulled me to the back of the airplane. And there in the rear galley of the aircraft, I saw a very heavy-set woman lying on the floor with her legs up in what appeared to be a pool of blood and urine. I saw far more pubic hair than I ever expected to see on U.S. Air. And the woman took one look at me and began to scream. And she screamed louder than I have ever heard anyone scream. She screamed so loud that the wings on the aircraft buffeted. She screamed so loud and thrashed so much that the glassware in that rear galley shook in its cabinetry. Certainly everybody on the airplane turned around to look. And I would suspect, quite frankly, that people on other airplanes in nearby airspace turned to look because they could hear that woman screaming. It did not take a medical school graduate to see that she was about to have a baby. Turns out she was 37 weeks pregnant. This was her 5th child. What made her decide to travel cross country at that point and break her water, I don't know. That's another story. But when I realized what was going on, I said, hey, that's so cool. I'm going to be an OBGYN. Yeah, this is really, what am I going to do now? But hey, I had done this before. I had been in a similar kind of situation, albeit one better controlled and with people standing over me and watching me. So I said, I can do this. So I knelt down. I got some gloves from the medical kit. I got soaked in her body fluids. But the head started to crown, and I controlled it. And I got her to pull it together enough to give a nice push, and that head came out. And like I had been taught to do, I felt around the neck to make sure that there was no umbilical cord wrapped. I pushed down and delivered the anterior shoulder. I had her push again, and I lifted up, and I protected that posterior arm and delivered that baby into my hands. And I looked at him, and I could not believe that there was a life that just got born into my hands, and that my hands were the first one to touch him. I couldn't stop staring. I didn't realize that when he started to cry, everyone on the airplane started to cheer. But I stared. And I realized that this child was going to grow and one day smear chocolate birthday cake all over his face. And that one day this little boy was going to ride his bike with a friend. And that one day he was going to bring home a paper that he wrote about how much he loves his mommy with a smiley face at the top from the teacher. And that one day he was going to go off to college and leave his parents alone. And that one day somebody was going to break his heart. And that one day he was going to love and be loved by someone. And maybe he would go on and become a U.S. Senator or President of the United States. Or maybe he was just going to work at the 7-Eleven, but one day he was going to smile at someone and change their life just by doing that. And I couldn't stop looking at him until the flight attendant kicked me and said, "Aren't you supposed to give him back to the mother?" I said, yeah. So I put him back on, put him on the mom's chest, and at that time the medical kits didn't have really much else in them except for a pair of scissors. We took some shoelaces and tied off the cord in 2 places and cut the umbilical cord. Her placenta fortunately stayed inside, and that airplane got to the ground faster than I have ever seen an airplane do, and it delayed us by about 4.5 hours because they had to change out the airplane. It looked like a murder scene there in the back. But what I realized in those skies over New Mexico was that it was his time to be born. And the other thing that I learned from that was the power of endorphins and the power of anandamide. You've heard of the runner's high. Runner's high is caused from anandamide. This was what I call the mother's high, and I've seen it countless times since. I was able to witness a woman who was a whirling dervish, of a screaming banshee, of a Tasmanian devil, in a matter of moments, when her baby was on her chest, turn into the most serene human being I have ever encountered. That's powerful stuff. That's what's coursing through our veins, and that's what our endocannabinoid system does. So when we are short on endocannabinoids, we get sick of what I see most commonly in my practice. I see sexual dysfunction, I see anxiety, I see sleep, I see things that people think of as hormonal problems, which I treat as hormonal problems, but all the stuff that goes along with that. Now, there are disease states that I believe we can treat with CBD and with phytocannabinoids, but we got to be careful about what we say. And even as you walk through that exhibit hall and see what people are saying, I would encourage you to be careful about the claims that you make. We can't make many of these claims legally until these things are supported by data. Data is very important, and that is what you're going to see a flurry of probably in the next 2 to 3 years. Now, I want to talk just briefly a couple of terms there, the full spectrum versus broad spectrum thing. I understand full spectrum. Full spectrum is all those brilliant phytocannabinoids, but with one issue, and actually there's an error in this slide. What is the error? Anybody know? Yeah, there's an extra 0 in there. The one thing that we know about full spectrum CBD, and that you should be able to be assured of, is that it has less than 0.3% THC, right? And I have 0.03, but it's 0.3%. When they take what they call broad spectrum, and to be honest, if the industry had asked me, which it didn't, I would say don't use that broad spectrum term. Just call it's THC free, because that means something to me. Otherwise, it's just a euphemism. It's just covering up it makes it more confusing. Full spectrum versus THC free is what I would think of. In my clinical practice, I do not recommend THC CBD unless somebody has a really compelling reason. And the most compelling reason, honestly, it's probably more of a marketing phenomenon. The most compelling reason is because some people work in jobs where they are worried about getting a drug test that shows THC. Maybe they're a fireman or policeman. They work with children. They can't have a positive drug test, and so they want the THC-free model. I will tell you that this is actually something that we are studying, that issue of drug tests. But nevertheless, these things work better when we can use them closer to the way nature gives them to us. And the more we screw with them, the more likely we are to run into trouble. A very wise man I heard talk a few weeks ago said, "Mark my words, 15 years from now, I'm going to be retired on a beach someplace, and somebody is going to come out with a paper that CBD causes blank, causes cancer, causes liver disease, causes strokes, causes something or another." And he said they will be right, because we will have messed with it so significantly by that point that we don't know what the effect is really going to be. So for now, my recommendation is you take it as pure as you can get it from the ground. Now, I do compound medication with CBD, with CBD, and that is single isolate CBD because it's just easier for a pharmacist to be able to manage single isolate, to know exactly what's going in it, and to be very precise with that. So even that, though, I have to tell you, I feel plus minus about, because single isolate is missing that wonderful entourage effect that comes from the rich phytocannabinoid mixture. Now, I'll tell you how I typically dose these things. I really like tinctures. I really do, because it gives people the opportunity to be able to self-titrate, that they can use as much or as little as they need in order to get their desired clinical effect. So it takes a little hit or miss, and I will tell you that too is probably one of the biggest obstacles for physicians, because we are not trained to think that way. We are trained to think in a very regimented fashion. And that is that I can give you a 33 milligram tablet of something that will have a predictable 80% bioavailability that will result in a statistically significant difference of 0.05 in some clearly defined clinical outcome. We're not trained to think about the fact that my endocannabinoid system is different than Adam's, that's different than yours, is different than yours, and that you may take 3 times as much CBD as I need to treat exactly the same symptoms. So I do bioidentical hormone therapy. I'm accustomed to knowing and to thinking that people are not one size fits all. So for me, it makes sense. And for, I think, the docs who embrace this, it's because there's an understanding that that botanicals place in modern medicine, and that all people are not the same. I think the sweet spot for most people and most indications is probably about 10 to 20 milligrams, maybe even 15 to 20 milligrams. So if somebody has a 500 milligram tincture, for instance, I say one dropper is going to give them 17 milligrams of product. So I say you're really better off trying to saturate those receptors quickly. For the first, let's say, 3 to 5 days, I want you to use a full dropper. You put it under your tongue, you hold it for 15 to 20 seconds, and then you swallow. After, as long as you can tolerate it. And after those first, 3 to 5 days, then you back it off. Then maybe you use a half a dropper. Then maybe you need 3 droppers. Let's hold questions, okay? We will. You do what you need to do to get to where you want to be. All right? So that's sort of how I dose these things, but it does articulate the need for medical grade CBD. And what do I mean? And by the way, I keep using this term CBD. CBD oil. We're talking about hemp oil, right? CBD has the highest affinity for the receptor, but CBD is just but one component of it. The most important thing about medical grade is very simply control from seed to shelf. And you'll hear that terminology a lot, seed to shelf. And what do I mean by control? If we are going to be able to produce something that is of pharmaceutical quality, then we really have to mimic the pharmaceutical process in order to get there. And so I think the highest standards of hemp oil involve a process that starts with analyzing the soil, knowing what the soil has and what's missing and what's rich in that soil. It has to do with how we handle seeds, where they come from, how they're protected, how they're exposed to the environment. It has to do with the water supply that's going to that plant, a very precise scientific approach to how that plant is grown, when it is harvested, and that there is a consistency in the yield from that crop across the same field, across every plant, and across the adjacent and neighboring fields. Consistency. It has to do with the extraction methodology, and I mentioned really smart people. Dr. John McKay, where are you? Wave your hand. There's a smart guy right there. There's a really smart guy, and he's. We were talking about extraction methodology. in the past, it kind of started with ethanol extraction, and then the tides shifted that CO2 extraction is really the best thing, and maybe things are switching back towards ethanol extraction, because the more these products, the biomass is heated, the more likely you are to cook off valuable components. And so we had a very detailed discussion that was far, far over my head. But he's given a great lecture in a couple of hours, I think at 11 o'clock. So if you have any interest in extraction, that is the place to be. Process, bottled and packaged, and really what you can know about that given product is very important. So the certificate of analysis, or the C of A, that's also terminology that you will hear. This is what a C of A looks like, and what you see over here, this is the phytocannabinoid mixture, and it's telling you exactly what's in there. I think further to look at what the potential contaminants are. This is looking at E. coli and other coliforms, looking at yeast, looking at molds. This is looking at pesticides, because these are grown on an organic farm that's pesticide free. You want to make sure that your product is. And looking at heads and the presence of those there. Now, this is the point in the program that comes to a screeching halt. So I'm going to try to make this as interesting as possible. I want to tell you just a couple little things about the clinical trials, the clinical research that now, because clinical aspect is really important. Now, we've got some stuff going on at the University of Louisville that's looking at real hard science bench work, and that stuff is very lofty. And I'm a clinical guy, so I want to tell you what the clinical research means. Well, again, I think the most important thing to talk about is sex. So I am looking at full spectrum hemp oil basically as a sexual adjunct. What does it do to a woman's sex drive? What does it do to libido? What does it do to arousal? What does it do to orgasm? And what does it do to overall satisfaction with sex? For men, we use a lot of tadalafil. Tadalafil is Cialis, and I actually usually compound that with some oxytocin, which is another hormone. Erectile dysfunction is one disease, but erectile function is something that every man is interested in, right? So it may not be a dysfunction. It may just be the desire to function better. So we're looking at, well, what happens if we add a single isolate CBD to that tadalafil, as compared to, well, someone who just is using a tincture orally and taking the tadalafil, and seeing about what this means for satisfying sexual encounters. In sleep, again, anybody who's ever tried CBD you know what it does for your sleep, but here's a little thing that you can do in the privacy and comfort of your own home. Right? What does the sleep app tell you? If you got a Fitbit, or you have get a sleep app, you can get a 99-cent sleep app on your phone. Get a curve for a couple of days. Let it see what you're doing, how you're sleeping. Let it show how many times you wake up and how many times you roll over and snore and all the rest of that. And then start using CBD and see how that curve changes. And it's very remarkable. And it's very interesting, because that's a little science you can do in your own home. I wanted to study, empirically, I have found that people using full spectrum product as opposed to the THC free typically just do better with most things. And sleep is one of them. So that's something we're doing a comparison of. Same thing as it pertains to anxiety and how people feel. We are looking also clinically at the self-titration method in terms of self-reported outcomes on anxiety. We're looking at, there's an interesting one, that idea about, I'm freaked out about my drug test. Well, we're looking at standard urine drug screens in people who were otherwise cannabis naive, and seeing what's the likelihood, if they're not using any other form of cannabis, that using a simple bottle of full spectrum hemp oil for 1 month, what effect that's going to have on their urine drug screen. Simple science to do. Interestingly enough, you put the damn stuff in your mouth, right? Gingivitis is actually a big problem. It's not something I see so much in my clinical practice because I'm looking in the other hole. But nevertheless, if you swish this around in your mouth, the people who do that sort of science tell me that there is a clear difference in being able to measure pits in the gingiva, which is a marker for gingivitis. So easy something to study there. And of course, we're looking at some stuff using pain disorders and that self-titration methodology. So I'm going to wrap it up here as we get to the end. And I'm going to ask you a question. And my question is this. What will you do for this? I don't mean what's your company going to do. What are you going to do? This reminds me of a story. I know, it's hard to believe. Again, going back to my training. When I was an intern, I met a woman. At the time, she was 91. Her name was Miss Faye. Miss Faye had a gynecologic malignancy. Over the next 4 years of my residency, she had countless hospital admissions and also just dealing with getting older. She had a very tough time, but I got to know her family very well. I felt like I was a member of her family. She had 7 kids, she had 16 grandchildren, and I don't even know how many great-grandchildren. When I was a 4th-year resident, it became my responsibility to be the one to call her family and tell them that it was time to come and be with her because her life was ending. And I remember that day like it was yesterday. They asked me to be in the room with them, and I was happy to. Her oldest son's name was Gabe, and Gabe was crying. And Miss Faye patted him on the hand and said, "I'm not ready to go." And he said, "It's okay, Mom, because we're all here." And she said, "I know you are, but I'm not ready to go." And he said, "What do you mean?" And she said, I appreciated that you all came here, but I just don't think I can die right now." And they looked at me, and I said, "Then don't die." And Miss Faye went on to live for another 2 years and ultimately died in her sleep at home 2 years later. When I say the right time, it wasn't Miss Faye's time. You know? It just wasn't her time. She fooled us. But it was time for somebody to tell Dr. Ego that he was an asshole. It was time for me to learn that I could change lives by changing minds, one at a time. It was time for that little baby boy to be born in the skies over New Mexico. And to be honest with you, like I said, I don't think most things happen accidentally. It's no accident that you guys are here and that we are together in Seattle. Because for you, I think it is the right time right now. And so I will ask you, what are you going to do with that time? Thank you very much. Thank you. Thank you. Yes, ma'am. Before we do that, there was a question during the talk there about About children, yeah. What do I think about children? I do believe children can use CBD. Obviously, they're smaller, and so you need to be a bit more gentle. Use smaller doses, but I think titrating those doses is fine. It may be as simple as a drop or two. I was talking with someone yesterday about using gummies in kids. I'm a little dubious as to how much CBD someone's actually getting when they're using a gummy, but nevertheless, if it works for you, then I think it's fine to try.
First off, thank you so much. Great presentation.
Thank you.
On the dosing, when you said 10, I think it was 10 to 20 milligrams or 15, is it once a day, twice a day, and when do you recommend taking it when you're giving someone the first idea of start now?
Yeah, it's a great question. So I typically recommend people start it at night. And why is that? Because we in Western civilization have very poor sleep hygiene, right? And so one of the things that almost everyone is going to see a result from is an improvement in sleep, because that's where our cup is half empty. Right? And maybe one of the cups, but it is certainly one of the more profound ones. So in the beginning, it may make people sleepy. Pretty quickly, I think that getting sleepy effect will wear off if it does at all. But it may not make them sleepy, but it is almost certainly going to help them to sleep. So I recommend starting it at night. And starting it, I usually recommend starting it once daily with, if anxiety is a big issue, then adding a little on a PRN or as needed basis, a drop or two during the day later on is fine as well. But after saturating those receptors after the first few days, that's when somebody is going to be able to really define what works best. Maybe they need a little at night because they're going to do their main dose at night because it helps to quiet the mind. It's going to help them sleep, which is going to improve their cognition and help them during the day. But also maybe they need a little bit in the morning because their mornings get anxious, or because they need to feel a little bit more calm. And then sort of just as needed. But I start at night and then add other dosing as it's required.
Understanding that research is still a little light right now, have you personally had any experience with patients who maybe have an opposite effect when they take the CBD oil or the hemp oil? Instead of it quieting them, they feel a little more awake or energized, I guess, by it?
I have had that experience. I will be honest that the people who stick right out in my mind, with whom I've had those experiences, are people who have a lot of other issues. Let's say that these are difficult patients to deal with to begin with, and so it's hard to tease out what is really a physiologic effect versus what is a dramatic effect. And I mean that with all love and respect, but that's kind of what it is. But so does it have the potential to activate instead of to suppress? I think it absolutely does. Yeah.
What do you? Okay. What do you say for? What would you recommend with regards to people in the professional space? So the CBD store, a lot of the brands that are here, everyone has a different answer to not being a medical professional, but they're put in a position where they have to play the medical professional with the knowledge of basically, some layperson
right,
who's working at a CBD store or who's answering to these really very meaningful questions about how does this work. And there's this disconnect between obviously Western medicine and, all of us who are in this space to communicate, educate, and inform consumers and retailers. Mm-hmm. But we don't have people like you everywhere, and there's such a disconnect, and trying to figure out how to answer those questions to consumers and retailers, saying, how do you know this? Well, I'm not a doctor. I don't come from Western medicine. I didn't go to medical school. But there's times where I feel like I am way more knowledgeable than most of the people that are communicating information about CBD. And so there's this kind of this disconnect, do you know what I'm saying? Like trying to find an answer and trying to find a relationship with a consumer where we can establish trust with them, but we're not doctors. And it's hard to have that conversation, trying to see if you recommend anything with that.
Thank you for saying that, and that you're articulating a scenario that I say that I hear all the time, and that is, I'm not a doctor, but I play one in the GNC, right? Or I play one in the head shop, and so a patient may come to me and ask, and I am giving my clinical medical advice, and they say, yeah, but the guy in the GNC told me, the guy with a high school diploma who's been working there for 4 months, that that the blue vitamin is really better than anything I'm going to get anyplace else. So how do we deal with that? Well, specifically as it pertains into this CBD space, you're absolutely right. And you probably, in fact, everybody in this room probably knows more about it than most clinicians do. They may be a very educated lot of people, but probably not about this. And so how do we do it? We do it one mind at a time. And so that's why I said, I think we should have some common language. And it's through events like this where we can weave that narrative of what is that common language that we will all speak, so that if I go into your store in Seattle, that it's going to be the same answer that somebody's going to get at your store in New York. It is learning to speak that same language and sharing with other people what that language is, so that we're all speaking in the same verbiage. I think that's where it has to begin. Call me, I'll tell you anytime.